Hi everyone, Dr. Tina Sagosho here, and we are beginning week 3 of Perimenopause Awareness Month. And I hope the last 2 weeks have been helpful in giving some information about what perimenopause is, acknowledging that it is a real diagnosis, it is a true hormonal shift, and the timing by which it can start, our early to mid 30s, as well as the host of symptoms. It's a wide spectrum of symptoms that can start to show up in these years of perimenopause. But as we approach the next 2 weeks, I want to spend some time providing some guidance of how you start navigating this time with your providers. So the controversy seems to be about blood work. I encourage blood work partly because, we want to make sure that patients do not have any other underlying conditions that may contribute to their symptomology. Notably, looking at the thyroid, looking for nutritional deficiencies like low B12, low vitamin D, sources of anemia, especially for someone who might be having heavy periods. And so it's important to do blood work. Now, the hormone levels, are likely going to be within normal ranges for the duration of perimenopause. And it really isn't until the very end stage of perimenopause, as that march towards menopause starts to happen, the cycles are getting further and further apart or stopping altogether, and the symptoms are starting to become more persistent, that the blood work starts to change, the hormone levels start to change. And so understand that blood work is tricky. It is a picture in time. It doesn't always tell the full story, but it's a guide. It helps establish a temporary foundation of where someone might be at that point. So it can be a little frustrating if you are met with, "You're fine, your labs are normal." Well, the hormone levels are likely to be normal. And hopefully there are no nutritional deficiencies, no signs of anemia, low iron, or thyroid dysfunction, because those are things that can be corrected and may improve some symptomology. So again, blood work is tricky, but it is helpful. But a very experienced provider is going to be able to interpret that blood work appropriately and have a very thoughtful discussion with the patient about what else is going on, acknowledge perimenopause for what it is, and certainly start talking about lifestyle, sleep, nutrition, movement, as well as hormone therapy. Hormone therapy is just one option. And of course, there are several other lifestyle options, as well as recognizing that holistically, we have to look at the importance of sleep, stress management, nutrition, movement, and supplements. And so don't always settle for, "You're fine, everything's normal." Push your provider to have more of a discussion about why you're having symptoms. And if you're not satisfied with the answers, talk to another provider. And so hopefully these next 2 weeks will provide some further guidance and insight as to how you can navigate through this time, as well as work with your providers in getting the right guidance, counseling, and feedback.